Here we go. All right, so while we're waiting for people to get on, I will start because I'm not going to be here long, but I just wanted to share a story with you guys. And I just wanted to say, I don't know, just talk about relationships with doctors. I wanted to talk about how we trust doctors with our medical care and we don't really ask them the questions that need to be asked. And doctors should be your partners in your medical care. They should not be leading your medical care. You should be fully involved and not just following their orders blindly. And I wanted to share a story about what happened in a doctor's appointment with Dylan. Now, I'm not your typical patient and I'm not your typical mom of a patient because I have more pharmaceutical knowledge than an average person just because of my career and speaking to doctors daily about different medications and being trained and studied on medications and different disease states. But I want everyone to be aware of this because you don't need to be trained on different disease states to actually participate in your medical care. And you should not believe that doctors know anything about your body and have your best medical interests at heart all the time. And that's sad to say because we go to them for advice. They've been to school, but not every doctor has your best interest at heart. So I took Dylan to the doctor, a new hematologist, and we moved. So the hospital that is near us is a different hospital than we typically go to for his medical care. So I took him there for an ER visit, and he ended up having strep throat. And the ER doctor recommended that I go to their hematology department just because we live close by, and you know, if anything happens to Dylan while we're in our area near our home, that the hematology department will be aware of Dylan and his case, and they'll have records on him. And so I agreed. So I went to this new hematologist, and the hematologist, we talked. He, did the regular routine visit stuff. And the hematologist then said to me, that I should consider putting Dylan on Hydroxurea, which Hydroxurea is chemotherapy, and it's used in cancer patients, but they are also using it in sickle cell patients because there seems to be some benefit in reducing the amount of crisis or pain that the sickle cell patients are having. And so I've read about Hydroxurea, but I didn't talk. I let the doctor speak. So he tried to convince me for about 30 minutes to put Dylan on Hydroxurea. Now, one of the things that I said to him was, well, if our old hematologist told me, Dylan is not getting sick as often, and he's only had a few crises. He has never had a blood transfusion. So, Hydroxurea is something we would talk about if he started coming into the hospital more frequently and if he had blood transfusions. And so we didn't talk about Hydroxurea, but this particular doctor said that he wanted to start Dylan on Hydroxurea, even though Dylan has been healthy. He has not had a pain crisis in over 2 years. He said that they want to start every infant on Hydroxurea. And, I'm listening to him, and he's excited about the fact that it will reduce his white blood cell count, which in sickle cell patients, they have an elevated white blood cell count. And they don't think that that's good, even though your white blood cells help fight infection. They don't think the white blood cell count is helpful because of the white blood cells being sticky, and they don't think it's beneficial for them to have an elevated white blood cell count. So we talk about this, and this is very clinical, but I wanted to share because this doctor specifically said to me that Hydroxurea does not have any side effects, because that was my next question. What are the side effects? and he said Hydroxurea does not have any side effects. And I said, what are the long-term effects? Because Dylan would be on it, the way that they're prescribing Hydroxurea for sickle cell patients, Dylan would be on it for the rest of his life. And he said there are no side effects. Unequivocally, no side effects. Right. That's a lie. Right? One of the side effects, and I'm not going to go all the way into Hydroxurea. I'm actually going to do a full video on how to read a package insert, because if a doctor prescribes you a medication, you should be able to quickly read inside the package insert to see for yourself some of the precautions that you're supposed to be taking while taking the medication. Another thing is talking to the pharmacist would actually be more helpful than the doctor, because a pharmacist is specifically trained on medications. Doctors prescribe the medication, but sometimes the pharmacist doctors, especially internal medicine, they see a wide variety of patients, so they're not as well versed as a pharmacist on the specific medications and their side effects and their drug interactions. Pharmacists, that's all they study. But doctors, you know, they have their own agenda, and I don't know what the agenda is, but I'm going to tell you one of the main side effects of Hydroxurea that this particular hematologist told me had no side effects. Male infertility. Based on, and this is male and female infertility, but specifically in the package insert, it says, based on findings in animals and humans, male fertility may be compromised. Okay? Hydroxurea may damage spermatoza and testicular tissue, resulting in possible genetic abnormalities. Okay, and number 3, which is also in the package insert, Hydroxurea is a human carcinogen in patients receiving long-term Hydroxurea for myeloproliferative disorders. Secondary leukemia has been reported. So those are the 2 things that I want to point out. 1, you want to give my child something that will cause him to be infertile, right? Infertile. He will never have children. And if he did have children, there will be significant genetic disorders with this child if he was able to conceive. So that's 1. 2, you want to give him something that will cause cancer, because secondary leukemia has been identified, meaning even though this drug is used to treat cancer, it has also been seen in studies that the drug can cause cancer or a secondary cancer that wasn't present before the drug was given. Okay. This is why we have to be, now, because I'm the parent that I am, meaning I have the knowledge about medications and reading package inserts that I have, I know this information. But there are so many moms and so many parents that are putting their children on this medication, and I understand. I don't judge, because I understand that place. I remember when Dylan was in the hospital with a crisis and in pain, and you know, there is nothing you can say to a mom whose child is in pain or getting blood transfusions. You know, when you're offering them a ray of hope and sunlight, I understand. But let them have all of the information. Let them know that their child will never be able to procreate, ever. Okay? And this is long-term effects. For cancer patients, they take chemotherapy for 2-3 months, and then they're off of it. But they're asking us to put infants, starting, I've heard as young as 8 months, on Hydroxurea for the rest of their lives. And they're saying to parents that this drug has no side effects. And I know he's not the only hematologist that's saying this, because I've spoken to other parents who have their children on Hydroxurea, and they say to me, oh, there's no side effects. And I'm like, now it sounds exactly like talking to my hematologist. There's no side effects. And that's not the case, you know. And one mom even told me, you know, my son's hair is falling out. In fact, a few moms told me my son's hair is falling out or my child's hair is falling out. That is a side effect, right? So don't say that there are no side effects. There are side effects. When you're working with your doctor, you should be partnering. And you should be able to make decisions with full information. A doctor should not be able to say there's no side effects or leave information out to get you to do something and you accept that information, one, without asking questions. Don't be afraid to ask questions, right? Why should I give this to him? Have there been studies on this? What do the studies show? What are the long-term effects? Like, ask questions, but also read your package inserts. They come in the medication package. Even before you go to the pharmacy and get the medication, you can go on the website. You can go on the FDA's website and get the package insert for any medication. You should be able to go and get the package insert for any medication. And yourself, some of it looks like Greek, right? But look for indications, right? That's one of the first things you're going to see in the package insert. And look for warnings and precautions, right? What warnings and precautions, and look for contraindications. Okay? I want to do a YouTube video specifically going through a package insert, and I'll do Hydroxurea so we can break down. There's so much that this drug has in its package inserts that the doctors don't talk about. So a parent should be able to, and a patient should really be able to go in and say, this is the drug I'm taking. These are the potential side effects. Yes, it can work, and yes, it can prevent, you from having a crisis. And that's what we've seen in patients that are taking it. However, am I willing to deal with those side effects? Do I want to never have children again, or never have children at all? Do I want to be at risk for a secondary cancer? Those are all of the questions that you have to ask yourself. So don't follow these doctors blindly. And this is for anyone, not just patients with or parents with children with sickle cell or sickle cell patients. This is for anyone, right? If a doctor prescribes you medication for diabetes, for strep throat, you should know. For the flu, we were talking about Tamiflu and people dying from Tamiflu. This was a really bad flu season. You have to read the package insert. It tells you things like this medication can cause death, and you won't be shocked at the risk that you're taking. You at least know all the information up front. I want all of the information, and then let me make an educated decision on if I want to put my child on this medication or if I want to put myself on this medication. And it's funny because I posted Dylan's video about the vitamins and supplements that he's taking, and a lot of the questions that I've gotten were, is it safe? Is it safe? But, and I bring that up to say, when doctors prescribe something for us, when they prescribe a medication for us, we assume that they're prescribing it because it's safe. And that question is never asked. You never hear, or maybe you do, but you should be asking your doctor, is it safe? What are the side effects? What are the contraindications? What are the possible outcomes of taking this medication? We should be asking that question. So I don't get mad when people ask, are vitamins and supplements safe? But I get curious. Are you asking your doctor the same question? Or are you just accepting what they're saying as this medication is the right thing for you to be taking and that it's safe? Just because a doctor prescribes it does not mean that it's safe. Okay, I hope that was helpful. Share the video. This is not just about sickle cell. This is about empowering parents to be more active in their child's care and in their own medical care. You're not, following a doctor blindly. You should be proactive and active in your research and in, just even asking the doctors questions about what they're doing and why. I hope this was helpful. I hope